Hello, everyone. Thank you for coming. Welcome to this session of NAUTO's 36th Annual Conference. We will be starting in about 1 minute. Before we begin, we want to cover a few housekeeping items. On your attendee screen, you will be able to enter comments and questions in the audience chat. We hope you will take advantage of this opportunity to engage with our speakers. This session is being recorded. The recording will be available in approximately 1 day by returning to this session in the agenda. We recognize and thank our Petabyte sponsor, the California Healthcare Foundation. All conference sponsors have virtual booths available during the conference in the sponsors section. At the booths, you can learn more about the sponsors, review materials, request contact, and collect game tokens. We hope all attendees will take a few minutes to visit each sponsor's booth. During each conference session, watch for a game token that you can collect for a chance to win a grand prize worth $250 or one of several prizes worth $50. Now I will turn the stage over to Norm Thurston, NAUTO's Executive Director, who will start today's session. Norm?
Thank you, Mom. It's good to be with everybody today. We're excited to have our first Igniter session to launch our pre-conference, and we're especially glad to have our sponsor for the whole Igniter series, Milliman MedInsight. So Milliman MedInsight is a NATO collaborating partner, and they've been good friends of ours for a very long time, and we're pleased to have them sponsoring our Igniter series today. Our first session in the Igniter series is today's session, From Street Address to Geolocation, Building Claims Infrastructure to Address Health Inequity. Our presenters today, or our guests today, will be Ioana Crisan from Human Services Research Institute and Katie Oberg from the Center for Improving Health Value in Healthcare. Let's go ahead and welcome them to the stage. Good morning and good afternoon to both of you. First of all, let's start with Katie. Katie, could you just tell us a little bit more about why this is an important issue?
Definitely. I think really the catalyst for taking on this project was living through the turbulence of 2020 and the COVID-19 pandemic, which really shed light on just the idea and really the problem that racism and socioeconomic disparities are the primary drivers of health inequity. For example, in Colorado, there was one point in May of 2020 where Hispanic folks represented over half of COVID cases, despite only being 22% of the overall population. And that's just one small example, and this issue has been true for a very long time, and COVID-19 just really brought it to the forefront. And then just here at Civic, we believe that APCDs are in a really unique position to be able to provide important information and data around these health disparities. Really sort of, I think the issue and the barrier that we've run into in the past is that payer submitted race and ethnicity data is usually very scarce and is poor quality. So it was important to us to be able to pull in population estimates of these race and other social determinants of health from external sources, like the American Community Survey, which is administered by the U.S. Census Bureau. And really where geocoding sort of comes into play is that previous research shows that these factors are most reliable at the census tract level as opposed to the zip code level. So to really do this job right, we have to take on this geocoding process and get at that census tract level information.
So I believe we've got a graphic here. Let's put that graphic on the screen that shows kind of how census tract level information works. Could you just explain a little bit more about what we're seeing in this graphic and why this is important?
Yeah, this is a really good example from the CDC of the level of granularity that we're able to achieve with geocoding. This is a map of data at the census tract level. And just for sort of a broader context for those that aren't familiar with Colorado geography, we have over 500 zip codes, but over 200,000 census tracts. So that's really sort of a good measure of the scale that we're talking about with census tracts. And what this map, I think, does a really good job of showing is that metropolitan areas like Denver, for example, can have a lot of variation within them. And so being able to report at that level really allows us to be a lot more nuanced, whereas reporting things at the zip code and the county level, it's very valuable, but can sometimes gloss over these details that can be important context to understand.
Fantastic. So let's now talk a little bit about the process that you have gone through, because I was going to say that you would have to go through, but you've actually gone through the pain of actually doing this. And so, Ioana, what was the goal of going through this entire process? What did you want to get out of the data process on the back end?
So what we're looking for here is a translation of the detailed street level addresses into a geocode, and that is the key there. The geocode allows us to connect to other databases. So for example, the census statistics, population statistics, and CDC statistics. So that geocode is typically a numeric code that is representing the area that we're looking at. And to do this properly, we wanted a tool that offers both the geocoding in terms of translation to latitude and longitude, so we would know the point location of person and provider addresses, but also we would also have the census identifiers. So for that, as Katie pointed out, what we're really after is the census tract, although we looked at what's available and we're able to input or the selected tool had available also state legislative districts, congressional district information, so we brought those in as well.
Okay, so looking at this graphic that we have on the screen here, so you're starting with information from the all-payer claims database, and those are addresses, and maybe you can talk a little bit more about what those are in just a second one. But through that process on the back end, you're getting out latitude and longitude, and you're also getting at those FIPS codes or the census codes that will allow you to match their data. So why don't you tell us a little bit more, I guess, first about the input data. What does that look like?
So in the context of APCD data, we're not working with a few 100,000, but we're working with millions of observations. So when I refer to address observation, it means really, one particular location can be spelled out in address detail in many different ways. There can be misspellings, there can be incomplete information. So that really translates in a multitude of observations. And so as you can see on the screen, person address observations were 12.8 million. So that was the largest data extract we had. Provider addresses in the APCD context, we had 1.6 million. And alongside with this, an important piece for other processing in the data warehouse was to geocode all available addresses from NPES. And this represents both the business mailing addresses that providers have in this NPI registry, but also the practice location. So in the past, this used to be the primary practice location, but NPES now includes the non-primary, so the secondary practice locations as well. And on the other end, where you see the output, what we were looking for is, as I mentioned, the latitude and longitude, but also the geographic identifiers. But just as important was to have information about accuracy of the returned output.
Well, thank you. By the way, if there's anybody in the audience that has questions or comments, please use the chat tool. We would love to hear from you. We want to make this as interactive as possible, and if you don't express yourselves, it's kind of hard for us to respond. So let's now then talk about then this process that you've adopted. So I'm going to pull up the next graphic here. Let's go ahead and put that on the screen. So this shows an example of some input data, what you might see, and then some output data. So would one of you like to talk to me about this input data and what's good about it and what's bad about it and why it's a problem?
So this is an example that is it's behaving really well on the output end, but just so you're aware, this is typically encountered in real address data where we have a particular location represented in many different ways. So you can see the different spellings. So this is a hospital location, St. Joseph Hospital in Denver. And the addresses you see come from NPES. So it probably represents distinct NPIs and the addresses they have entered. So some of that address includes information about the particular department of the hospital or other details that are not important for the actual geolocation processing.
Yeah.
However, these are translated, these were parsed by the tool we have used into the elements that you see on the right. So you can see that they all refer to the same parsed address number, address, street, city, state, zip code, which are the most important.
Yeah, I can see that. I can see that there's a lot of extraneous information here. There's extra names, floors, rooms, suites, etc., and that's not helpful for geocoding. So then let's go ahead and go to the next slide. So once you've got that cleaned up, there seems to be another step that you're using to get this data. So tell me a little bit about that encoding tool, if you will. Is this something that you did manually, or where did you find this tool?
So this is the output that you see on the right side is the result of processing the input addresses you see on the left with the same geocoding tool. So this is a good example in the sense that it shows us that the tool was able to parse the addresses, find the match in one of the 1,600 databases of addresses they have in the tool, and they were all assigned the same latitude and longitude. So this is what we want to see. Alongside with that, you see the accuracy score and accuracy type. Those again are very important elements, and in this case, this is like the perfect outcome. We have an accuracy score of 1 on a scale of 0 to 1, an accuracy type of rooftop, which means it's really located on the exact parcel. So this tells us that we can have confidence in the output, a high degree of confidence. Of course, we didn't rely only on the output provided by this tool, but we did some testing to compare, is this information really matching what other similar tools would have? We tested by looking in Google to see, is this the location we would want to see? And all of this indicated that most of these addresses were, the output was what we were hoping to see.
And how long does it take to process 12 plus million patient addresses? Do you want to talk about that for just a minute?
So some of these data extracts took hours, but some of them took days to process, and that's both due to having, very, very large data extracts, but also, as probably anticipated, there were some issues at times with the processing, so the processing had to be restarted. We also refined the input. After looking at the output, we realized there were some more refinements we could do in the input data. So all of this is to say that we have contracted to use the tool for an unlimited number of addresses and processing for 30 days. And we definitely needed those 30 days for the processing of the addresses I spoke about.
Wow. And so as you mentioned, your processing tool, so you're partnering with a vendor, and then they have these massive set of databases where they can look at addresses and give you back. What's the most important piece of information that you get back in that output set right there? What's the most helpful bit of information there?
So for the purpose of what we're talking about today, to be able to link to the additional statistics from the census or other entities, the most important piece is the full FIPS code. So that gives us the information of what this address is translated in census tract, and will be then, used for linking to population statistics such as poverty rates, etc.
Okay, and so Katie, let me just ask you, bring you back in here on this conversation. So if you have that 11-digit full FIPS code, what sort of power does that unlock for the database? What are the sorts of things that you could use that for that make this whole process worthwhile?
Yeah, I think, in addition to the types of variables we've been talking about previously in this conversation, I think just one other good example of something that would be really relevant and would add a lot of value to healthcare reporting would be pulling in measures of the physical environment, which is something that wouldn't necessarily come from the census tract, but is also publicly available in information. I think just a more specific example of this would be pulling in information on air pollution or air quality and presenting that alongside with a report or analysis on asthma or other respiratory conditions. But that's just one example. There are infinite really examples of other things that we could pull in and use with our data.
Thank you. So now that you've kind of got your whole process ready to go, what are some of the lessons learned? So our audience, there may be people out there who are doing this or who want to do this. What would you say were the top 2 or 3 things that somebody needs to know before they set out on a thing like this? Either one of you. Ioana, do you want to take that one?
I can start. So first of all, it's important to be aware of things to look at. So I think we now have after having gone through this process, we have a checklist of things to look for when selecting a vendor. So those include what their processing capacity is and the speed of processing, ability to clean and parse address observations. So the example that I looked at implies that there was some inherent ability to clean those addresses and consider them the same. We want to test, do a lot of tests, both within the vendor tool that we're looking for and also compare with others. And it's important to keep in mind what the input data contains. So there were 2 specific scenarios that we generally, as a researcher or analyst, we must be aware of in the ABCD data. So the presence of PO boxes, and it's skewed towards more PO boxes in rural areas. So that's an important thing to keep in mind for any geographic analysis. And we had approximately in the person address observations, 6% were representing PO boxes. And the other scenario that it's important to keep in mind was for the Medicare population, we didn't have the street detail address. So all of that was translated into place accuracy. So it means we didn't have the precise location, but centroid, zip code centroid, or place city centroid. Anything else? Katie,
let's just grab this question real quick from the audience. So Sunny asks us, can we know what vendor that you used? Is it a secret, or are you able to tell us which vendor you had decided to use?
We decided to go with Geocodio.
Okay, but you had looked at others and then picked them as being the one that would best meet your needs. Okay, very fair. And then lessons learned on the output side. We've got about 30 seconds to go. Katie, I want to just wrap us up with last lessons learned.
Yeah, no, I think from the output perspective, I think it's just really good to sort of understand these limitations that we've sort of previously discussed and how prevalent they are in sort of the data that you are pulling for your specific purpose. Thinking specifically about the Medicare population and how street addresses are not available, that would be something that would be good to keep in mind as an analyst as you are developing your report. And it's also very good to disseminate and document for any sort of end user that's looking at your data as well.
Okay, well, thank you, everyone. We are at time. I just want to thank our presenters today, Ioana, Crisan, and Katie Oberg, and also our audience for participating. If you look on the screen you're looking at, you can scroll down and see their speaker bios, and you can also see a session summary and some graphics from today's presentation for your follow-up. Thank you, everyone, and we'll see you next week, same time, right back here for our next Igniter session. Goodbye, everyone.